is it?
That's right. Yes.
Hi, I'm Dr Sadiq. How can I help you today?
Well, I'm not sure what's the matter with me. I'm feeling very down and very tearful.
I'm sorry to hear that. Tell me a little bit more about it.
The doctor here empathises with the patient and then asks an open question to gather more information.
Well, I've been married for 20 years and my husband, I found out about 3 months ago that he was cheating on me.
I'm so sorry to hear that.
He's left the house now, so I'm on my own and I'm just finding day-to-day living very, very hard. And I just don't know what to do. I'm really at a really low ebb.
Okay. Jane, can I just ask you a little bit more go into a little bit more detail about what's happened to you? Is that all right?
The doctor here signposts that she's going to ask further questions and then starts to ask more close questions to find out more about the condition.
Yes, sure.
So you said you've been feeling low. Has that been since you found out about your husband?
Yes.
Before that, were you okay?
Yes, I was fine. I've never felt depressed or crying all the time. Never been like this before.
Okay, so it's just since you found out about this.
Yeah.
All right, and you said, sorry, has he left the house?
He's left the house now. I'm on my own in the house, and I'm finding it. I go to sleep and then I wake in the early hours and can't go back to sleep again. So I'm feeling very tired, very lethargic. I don't know what to do. I've got no motivation to do things.
And what about, you said your sleep has been quite disturbed.
Yes.
And you're sort of waking up on and off throughout the night.
That's correct.
What about your appetite? How's that?
Oh, not very good. Not very good. And the other thing as well, which is really bad, I'm sort of a small amount of cigarettes in the day. I usually have about 5, but I'm smoking more. I'm feeling really stressed and.
I mean, quite often people do end up smoking more when they are feeling like this. So I think the main thing is to try and help you come out of this, which we will definitely try to do.
One of my friends suggested I might try St John's wort. Help might be helpful.
Was that something that you were interested in?
Well, I know very little about it. So.
Okay. All right. We can have a little chat about that in a second, if that's all right.
Yes,
can I just ask you a few more questions just about what's been going on and yourself, just before we get on to that, if that's all right?
The patient brings up St John's wort as a possible treatment. The doctor acknowledges this, but says that they will discuss it later, as she wants to gather more information before she makes a decision about this.
So you'd mentioned that you are smoking a little bit more. Sometimes when people do feel low, they turn to things like alcohol. Have you noticed that you're drinking any more than usual?
The doctor brings up the question of alcohol in a sensitive manner, normalising it.
No, just the smoking's increased, which I think is a really bad thing. I don't want to do it, but it's a bit comforting, I suppose.
Yeah, no, and we can address that. Hopefully, that will, once we sort out your mood, that will, we will be able to decrease the number of cigarettes you're smoking. So you don't drink at all, is that right?
No, I don't drink at all.
And I just have to ask, do you take any other drugs at all?
No.
You're on your own now at home, is that right?
On my own, yes.
Okay. Do you have any children?
Yes, I have 2 children. And my daughter, she's been very good, been around for a few days, but she's got a young child, who I look after. But obviously she's got her own family to consider as well. So.
Yeah.
In a case of depression, as with many other illnesses, it's always important to find out about family support.
And are you finding that when your day is to look after your grandchild, are you managing to do that okay? Is that something you're still able to do?
With difficulty. I'm finding, as I say, day-to-day living quite hard, really.
Okay.
And I don't know why I'm feeling like. Well, obviously the breakup of my marriage. After 20 years, it's a.
Yeah, no, sure. That's understandable.
It's very difficult.
Yeah.
With a patient with depression, it's always important to find out how the depression is affecting their everyday life.
And what about work? Do you work at all?
No, I don't.
You don't work, okay. All right. And so you've been feeling generally low since this happened, and you said your appetite is gone, your sleep is poor. And what about things like, you said you had no motivation. What about concentration? Like, are you able to watch a film?
The doctor here gives a slight recap and then starts to ask further questions.
Or something to get to the end?
I get no enjoyment from it at all. Normally I'd be okay watching TV, reading, but I just can't bring myself to do things.
Is there anything that you still enjoy doing?
Not really, no. It's the crying and the feeling so low and not wanting to get out of bed, and I'm just at such a low ebb.
I'm sorry to hear that. I mean, you mentioned that you had your daughter and she comes round now and then.
My granddaughter,
Is
yes.
there anyone else that you've been able to speak to at all?
No, just my one friend who suggested I try these herbal. Are they herbal?
Okay. Do you know, let's have a little chat about the St John's wort then.
The patient brings up the subject of St John's wort again, so it's obviously important to her. So the doctor decides to respond to this cue, even though it possibly isn't the best time in the consultation. This is a good example of responding to cues.
So do you know anything about that at all?
No, I don't.
All right. So St John's wort is a herbal medication. And now, unfortunately, it's not something that I can recommend that you take. The reason for that is that there's not very much evidence. So as doctors, all what we advise goes on what evidence is available. And there's not much evidence to show that St John's wort, how effective it is. So that's one of the main reasons. The other reason is that depending on where people get the St John's wort from, the preparations can be slightly different. So we're not sure that you're always getting the same strength every single
So
time.
it's only available over the counter?
Yes, it's in health food shops, that kind of thing, to buy, but it's not something that we would, as doctors, would be able to prescribe you as such.
I see.
However, there are other options out there, and I mean, obviously, you've been through a very traumatic life event, and I think that that is the most likely reason for you to be feeling so low, which is, you know, it is understandable. You've had a long marriage, and then for this to happen, unfortunately. So one thing that I would recommend is to have some counselling, perhaps. Okay. How do you feel about that?
After discussing the St John's wort, the doctor goes on to suggest counselling and asks the patient's opinion about this.
Well, is it going to take a long time for this to sort of happen? And what if I do have it? How, you know, what are the reasons? Will I get better quicker, or?
No, I mean it's a good question, but it's a difficult question to answer. The reason being that everybody responds differently to things. In terms of actually getting the counselling, we have a psychiatric nurse that comes every week, and we can get you booked in with them next week. That's not a problem from that point of view.
The doctor's very lucky here being able to offer counselling within a week. What's important is that you say what you are able to do in your own practice.
We can get you seen quickly, but how quickly you would actually respond to the counselling, that's a very much, you know, on an individual basis. But I think it's something that would definitely be worth a try if you would be happy to do that.
Very happy, yes.
The other thing was just to ask you, was just about, it's sometimes when people are feeling very low, people can end up hurting themselves or feeling that their life is not worth living.
This is always a very important question to ask. The doctor asks it in a very sensitive manner by saying sometimes people feel like hurting themselves or that life is not worth living.
Is that something that...
No, it hasn't crossed my mind, really.
Okay, that's good.
You know, I've got my little granddaughter too.
And that would stop you from doing anything?
Yeah.
Okay, well that's good. I just wanted to make sure that that was clear before we go on further.
I think that if I'm given help, that I will come through it.
Yeah, no, definitely, and I think that will be the case too.
Positive, yeah.
Yeah.
But it's just bringing me down at the moment.
Yeah, no, and I completely understand that. In addition to the counselling, we can offer you a trial of some drug treatment as well. It's not herbal medication, but there are tablets that you can take that just bring up the levels of sort of the happy chemicals, so to speak, in your brain. We can try that for a trial of a few months if that was something you were interested in. But some people prefer just to go for counselling to
I'm
start
not very
with.
sure about taking. Is that antidepressants?
Antidepressants, yeah.
Well, I'll just try the counselling to start with.
That's
if
absolutely
okay.
fine.
The doctor offers the option of medication here, but the patient declines it. It's a good example of developing a shared management plan.
Yeah, and I think that's a very reasonable, approach to take, is to try the counselling to start with, and then if we see you back in a couple of weeks, I know you will only have had 2 counselling sessions by that
So
point.
you have so many each week?
Yeah, so generally they see you, the counsellor sees you on a weekly basis generally. Obviously if they feel that things are getting worse, they can arrange to see you more frequently, or likewise if things are getting better, they can maybe space it out a little bit more. But You will be seeing the counsellor on a weekly basis, but I'd like to see you back in 2 weeks if that's okay. Obviously sooner if things are getting worse. If you feel you're getting really low and you think you're just not coping, by all means, please contact me sooner. And during daytime hours, I mentioned some people feel very low and wanting to harm or hurt themselves. If that happens to you at any time during daytime hours, please contact the surgery. Sometimes that happens out of hours in the middle of the night, and I'm going to give you the number for the crisis team. I hope you don't need to use it, but if you do feel like that, please contact them, and they are there for that reason. Okay.
That sounds very reassuring.
The doctor arranges specific follow-up to see the patient in 2 weeks' time. She also gives her specific advice about what to do if the situation becomes worse.
Okay.
Yes, thank you very much.
Are you happy with the plan that we've put in place today? Okay.
Yes.
So just to clarify, we'll set you up with the counselling sessions, which will start next week, and then we'll see you back. I'll see you back in 2 weeks myself. All right. Did you have any questions at all?
No, that all sounds very, very clear.
Okay.
Very helpful.
Okay then, Jane.
So how did this doctor do overall in the case? She took a very good history. She included red flags. She assessed that the patient was depressed but not suicidal. She then offered the patient options for management, and they came to a shared management plan together. Throughout the consultation, she displayed very good interpersonal skills. The consultation wasn't perfectly structured because she had to respond to the patient's cues about St John's wort, but overall I would have marked her as clear pass in every domain.
Okay, take care then.
Thank you very much.
Bye then.